Masks have been recommended for months now. What do you think is the right approach given where we are?
Well, there's two approaches. We obviously want more people in the community to be wearing masks. We know that that can help take the edge off a wave, and we know that pediatric emergency departments and pediatric hospitals are being overwhelmed. And of course, things are stretched in the adult healthcare sector as well. There's a couple of ways to get there. One is through a mandate. We know mandates work, and we know that if it's mandated, even if not everyone's adherent to the mandate, significantly more people will be wearing masks. And the other approach is to do some of the heavy lifting of public health, sound communication, sound community outreach, community engagement, lowering barriers to masks, normalizing masks, getting masks everywhere in houses of worship and in community centers and sports facilities and grocery stores, and just enabling people to put on a mask, communicating this effectively and normalizing that behavior. It looks like they're going to take the communication approach. I'm not sure they're going to do a lot of the other heavy lifting that would be really important to increase adherence to masks, but we'll see what happens in the press conference that lies ahead.
Dr. Bogoch, I still hear people asking if masks really work. Do they do anything?
They absolutely do. And I think we just have to be honest with the data. I mean, they work. They work at an individual level by reducing, not eliminating, but reducing one's risk of getting an infection from a respiratory virus. And then at the community level, they certainly do reduce the risk of illness at the level of the community. But again, it's not perfect. And I don't think we should be framing this that masks are going to stop a wave in its tracks. They're not, but they certainly can take the edge off a wave. And that's actually what we need. I mean, we just need a lower community transmission of these respiratory viruses. Obviously, fewer infections is better, but it also takes a lot of pressure off of the healthcare sector as well.
Are there key places, areas where people should be masking up to have maximum benefit?
Indoor settings. It really is an indoor issue. We know these are mainly viruses that are transmitted between people, mainly in close proximity, mainly through the air, and putting on a mask in an indoor setting will reduce one's risk of getting one of these infections. And of course, well, if someone is infected, reduce the risk that they transmit it to others. So yeah, this is an indoor issue. Again, we know COVID, for example, is primarily transmitted through the air, but there's a lot of other viruses that are circulating that are transmitted through touch, and hand hygiene is an important component. Obviously, we can't just be singularly focused on COVID. There's lots of viruses out there, and if you want to reduce your risk of getting infected, good hand hygiene, putting on a mask in an indoor setting, getting vaccinated for COVID-19 and for influenza, and staying home when you're sick.